Many of the social communication difficulties that come from autism spectrum disorder come from impairments in something that's called a theory of mind, which is one of the core deficits in autism spectrum disorder, meaning that in most people with this diagnosis, you have a disturbance in theory of mind. Now, theory of mind is two things broadly. One, the ability to understand other people's mental states, what they're thinking, and even try to interpret what they're feeling. Number two, understand and interpret the behaviors that come from these mental states. So you could see how if this mechanism is impaired, it would affect your ability to communicate in social environments. The reason is that through the repeated, adequate, and productive application of theory of mind skills, you develop empathy. And empathy is linked to social competence, or how good you are at communicating socially. Theory of mind relies on mechanisms such as memory, observation, cognitive flexibility, and self-regulation. So these should give you a hint as to what areas need to be targeted in order to practice specific theory of mind skills. I've added in the reading resources a couple of studies that speak about interventions that have been used to measurably increase the frequency of, or the amount of empathic behaviors, for example, in young children diagnosed with ASD. Please add any comments about any additional interventions or resources that may be of use for the audience in understanding and injecting this knowledge of theory of mind into the development of adequate social communication interventions. See you next time.